Half years with COVID, and the city has buried 504 people who died of COVID or COVID-related deaths. And so before we proceed much further, before we introduce our elected officials, our mayor and our city council president, we would like to ask everyone to please stand as we take observe a moment of silence on behalf of those families who lost a loved one and all of us who have suffered through COVID. And as we do this, I'm going to invite the Reverend Dr. Abraham Wire, who is one of the speakers for the symposium today. After the minute of silence, he will lead us into a short prayer of comfort and encouragement to the families.
We come before Almighty God, aware of our grief, our pain, our sorrow. As we look on the board outside, so many have a sticker to say they know someone, either in their immediate family or close by, who passed either directly due to COVID or related illnesses. Almighty God, we call you to give us peace and comfort and consolation. Remind us that your love is abundant and ever present, and empower us to do our part to reduce the deaths that could result from these kinds of illnesses. Thank you for all that is available in vaccinations and treatments and care, in boards of health and others doing everything they can. Help us to be partners with them, to be your hands in our community. I offer this prayer in the name of Jesus Christ. Amen.
Q&As. We have Bishop Tony Branch, who is the moderator of this great symposium today, so we thank him for being here with us. Now, I'd like to open the event with our mayor. Just over 2 years ago, I was looking for a position to see how I could be more helpful, effective in the fight against COVID. And that position was open at City Hall or in the city of Brockton, and I applied. And when I was interviewed, I received the warm welcome from the city, but most particularly from our mayor, Robert Sullivan. And so it's my almost honor to present our mayor to open the symposium today. Mayor Sullivan.
Well, first of all, I want to thank Dr. Eno Mondesir. I want to thank all the individuals that you'll be hearing from today. I want to thank Commissioner for what she does each and every day. I want to thank Governor Charlie Baker, Lieutenant Governor Polito. Charlie and Karen and myself were in this same facility when we got our first booster shot. They care about Brockton. That's why this facility was started as a local facility to help. And then thanks to the Baker-Polito administration, it pivoted to a regional facility. Today, you'll be hearing from a lot of individuals that have really been at the forefront of the COVID pandemic. And I want to tell you a couple things, and I won't be that long-winded, but I became mayor January 6th of 2020. And about 6 weeks later, I'm dealing with a pandemic in the city of Brockton. And listen, I'm not medically trained, I'm a lawyer, right? But my wife went to medical school down at Emory, and she had said to me, hey, Bob, this pandemic hasn't even come to the East Coast yet, right? It had come, China, Italy, West Coast, but it's coming. And so what I did was I asked all the medical providers in the city of Brockton, right? Of course, we have the VA hospital, we have Good Samaritan Medical Center, and Brockton Signature Healthcare, and our wonderful, wonderful partners, which I call our fourth hospital, Neighborhood Health Center. And we had a meeting, and this was before we had any cases on the East Coast. And I said, listen, this pandemic's coming. We have to think worst case scenario to get best case scenario. We haven't seen this in 100 years. And as Murphy's Law would say, I'm the mayor going to be dealing with a pandemic in the year 2020. But what I will tell you, what I learned that day when we had that frank conversation, and I was very blunt. I said, this isn't about how many census numbers or how much return on investment or your reimbursement from Blue Cross Blue Shield. I don't care about that stuff. This is about collaboration, making sure we have a healthy, safe community. And to the credit of everybody that participated, Brewster Ambulance was there, and Linda Cahill, who is our director of school nurses, Linda's here, and at that time, this was before Dr. Mondesi came on, we had a gentleman named John McGarry, who was the temporary Board of Health director, and it was all hands on deck. And so Mike Thomas, the superintendent of schools, and I, we closed Brockton Public Schools on a Friday. The governor did it on a Monday because we knew it was coming, right? And there's kids that I grew up with in Brockton to this day don't talk to me because I had to do things like curfews and closed gyms, and they're still mad at me about that, but I stand by it. And closing admissions to the housing authority, right? Only the residents could go there. And people were saying, this guy's being punitive. No, I'm trying to save lives in Brockton. And so being able to work with Mary Lou Sutter, Secretary Sutters, and working with Pinnacle Partners, and just working with everybody, right, to try to figure out how we're going to try to minimize and mitigate the spread of this disease. And Dr. Mondesi and myself and Dr. Rick Herman, our medical consultant, and Steve Hook, who's our director of BEMA, we would meet every single day, and strategize. And 3 days a week, Monday, Wednesday, Friday, we had a standing 1 o'clock call with every hospital and every clinician provider in Brockton to figure out how we're going to get to where we need to do. Now, was everything done perfectly? Absolutely not. But I'll tell you, what we did saved lives. And I created the Health Equity Task Force and the Wellness Trust team, where we hired external nurses, registered nurses, to help us, because the most vulnerable, the seniors, were homebound, right? And we knew that Brockton has always been a community of diversity, right? My own grandparents came from Ireland, right, to work in the factories. And we knew that it was generational living in the triple deckers. So you had your grandparents, and then you had the parents and the kids. And we knew close confinement was nothing but a recipe for disaster. And then what do we do about our homeless population? So we invited Father Bill's Mainspring to help us, and people dealing with addiction and substance abuse. We brought High Point to the table and tried to figure out where we can go. And the Baker-Polito administration stepped up because they gave us tents. So we actually used Perkins Park as a tent facility so that the residents of Father Bill's next door could come out, and we could do the 6 feet distance to try to save lives. And we didn't save everybody, and we just did a moment of sense. We lost a lot of people. And it was the worst part of my day at 4 o'clock when I got the death count and the sick count. And to this day, I still get that. And so I'm a proponent of continuing to work together. COVID is not gone. It is not gone at all. And you know how I know that? Because myself, my wife, and my 3 kids just dealt with it 2 weeks ago. Vaccinated, boosted, we have all that. And I can tell you, thank God that I did get those shots and I rolled up my arms, because I wouldn't be here right now talking to you. I was sick, and there's sick people right now. But then we have to look at, and the commissioner's going to talk to us, what are the tangible negative results of COVID? Well, people lost jobs, people lost loved ones, but also the mental health and behavioral health issues, right? And if you're trying to stay sober right now, the worst thing you can do is be cooped up in your bedroom for 7 to 12 days. And mental health issue, what I have to tell you this is, do not be ashamed of mental health. Seek help. Seek help. The suicide rate has increased. Domestic violence has increased. Alcohol and drug abuse has increased because of the pandemic. But we're the city of champions, and we're going to persevere. We're going to continue. So Eno Mondesir, to his credit, today, this is his brainchild. And again, I want to thank all these people. They could be with their loved ones today, enjoying a beautiful day, apple picking, pumpkin picking, but they're here. And all of you, you don't have to be here. Now, what my humble hope out of this is to take best practices away. Okay, Brockton, yes, you did this well. Obviously, we did things well because the state replicated that. The dashboard that we had, the daily dashboard, and I didn't think of it, and Eno didn't think of it, and Steve Hook, it was Rick Herman, he thought of this. The Commonwealth replicated that because it was something that hadn't been done before. And our friends in Randolph, Peggy's here today, they had outdoor facilities. And so, again, we're going to talk about a lot of things today. I hope to God never see a pandemic again in my lifetime or my children's lifetime, but we don't know, right? Monkeypox is around, and West Nile is around, and again, the flu could be bad this year, who knows? But I do know this, we will continue to work together as long as I'm mayor of Brockton. We have 106,000 people in this wonderful, wonderful city. And unfortunately, we don't have as many as we had prior to the COVID pandemic as we have now. We lost a lot of people. But it wasn't just a death count, it was the sick count as well. And the lingering effects of COVID, physically, financially, emotionally, are real. So again, let's continue to practice best practices, listen to our health clinicians. I do want to thank all the brave men and women that went to the hospitals or neighborhood health center every single day. They did their job, right? The nurses, the nurse practitioners, the PAs, the docs, but also the custodians and the people that are cleaning the building. I had some dedicated staff at City Hall that went around with these spray guns continuously to try to disinfect. I'll never forget that. So I won't be mayor of Brockton forever, I know that, but Brockton's home, right? It's my home, it's your home, and it's our home. And we have to continue to make sure we have a healthy, safe, vibrant home. So God bless each and every one of you. Again, I want to thank the commissioner and her team for what they do. And if you have any suggestions at all, right? My dad was a teacher at that Brockton High for 30-something years, and my dad would always say to me, no suggestion's a bad suggestion. You know what's bad? If you don't articulate it, you don't express it. So express your feelings today, and let's continue to work together. Thank you again. Thank you.
Thank you for having me. The council's position, during COVID was difficult. We had a lot that we had to do, but I gotta say, heavy is the head, and we have to give a nod to the mayor as the executive. He bore the worst of it. He had to make the toughest calls. As the legislature, our job is to provide support, to help guide the ship, to help push us in the right direction, but we need to, support the initiatives of the governor and the mayor and whoever needs our help with situations like this. And COVID was really tough. We depend heavily on going out and seeing people and talking to them and meeting them, and we weren't able to. So it was a unique challenge and a way for us to revisit how we represent people and work on their behalf. I want to give a nod and a thank you to the medical professionals, especially the folks who really jumped in and had to tackle this. They had to make the tough decisions. They had to say, look, try not to visit loved ones as much. Maybe call them. Maybe Zoom. Things like that. The criticism that a lot of them got, I think, is in its own backwards way a mark of their success. People will criticize because it never got to the point where it was so bad where even they sat down and said, oh, maybe we should have done that. And that's because our healthcare professionals saw what had to be done and made the appropriate action. And they did what they had to do, in line with their job. And and they took the appropriate steps, and I think they kept, we lost a lot of people, but I think, you know, they kept a lot of folks alive. So, you know, we owe a lot to the people who were on the front lines, to the people who did all that work. You know, it's our job to take their advice and to, you know, make laws with it and support it. It's our job to provide them the backup and the funding they need to carry out what they need to do. And I think we owe a very huge debt to Plymouth County, to the state, and to a lot of our local officials, like the good doctor here, who, you know, were prepared to do and knew what to do, what was necessary in order to keep, you know, as many people healthy and happy as possible. So I appreciate it. I think this is a great idea, everything going on, and I think you guys are in for a pretty good discussion. Thank you.
Good afternoon, everyone, once again. With respect to Mayor Robert Sullivan and the extraordinary staff that he has hired in terms of saving lives in the city of Brockton, we should give the Board of Health, all those employees at City Hall, and this mayor a hand clap. I've known Mayor Sullivan for 11 years, and I was very happy to know that he often said one life was too many lives with respect to deaths in the city of Brockton. So we are very, very happy that, I don't know if you all remember, a few years back, they had an ad, a national ad with respect to the presidential campaign, and they would talk about who would you want to pick up the phone at 3 o'clock, 4 o'clock in the morning. And I'm going to tell you, even though he's my friend, I'm so glad that Mayor Sullivan was here to pick up the phone during this pandemic. Vaccination, boost, and test should be the mantle of those that are in this room and those that are monitoring us on Facebook Live and other media. It is so important. I remember when I got COVID-19, and I'm going to tell you, I suspect that I had gotten it at a restaurant of a worker that was actually coughing pretty bad, and myself and my partner let it go by. We were sick 3 to 4 days later, and I can tell you, COVID-19, I'm speaking to the choir here today, but COVID-19 was very, very painful. I'm an insulin-dependent diabetic, and I can tell you, was I sick? I don't define it as sick. I was unable to get out of my bed. So what I say to people when we have this discussion, especially with this generation, I often hear them say, Bishop, what are you talking about? There's something in that vaccination. They're listening to what's going on Facebook. They're listening to fake news. What I say to them, and what I'm saying to all of you here, use your personal experience from family members to get the message out that you must be vaccinated, you must receive the boost, and you must be tested. If you agree with that, clap your hands. On the state level, understanding that there is a need for emotional support. I can tell you as a chair of a school committee, students need emotional support. Being isolated at home, many of them not only isolated, but they're isolated and then have to go to work because parents are sick. Immigration status is a problem. People are scared to receive services, not believing that they can get vaccinations because they think they can't get vaccination because of their immigration status. You know, these crazy messages that are out there. If you're in the United States of America, it's an all-in, and that's what happened on the city level. That's what happened in terms of public health, and that's what's happened in terms of the work that the Commonwealth has done on the Baker-Polito administration. So we salute them, and we salute them well. Brooke Doyle was appointed commissioner for the Department of Mental Health in October 30th of 2020. A licensed mental health counselor, Commissioner Doyle has both clinical and management experience and is a longtime champion for mental health parity and mental health access. Her experience in the fields of homelessness and substance use disorders is critical as we continue to reduce barriers to service access. Prior to being appointed as a commissioner, she served as the Deputy Commissioner for Mental Health Services, where she oversaw the DMH Adult Service Delivery System, led interagency planning and projects, and provided administrative and clinical leadership for all aspects of DMH statewide. Service compliance monitoring was also a part of her role. Commissioner Doyle is an alumni of the University of Massachusetts, where she received her Master's in Education and Rehabilitation and Counseling and her BA in Psychology. It is my esteemed honor to introduce Commissioner Brooke Dahl. Please.
First, I also would just like to extend my gratitude to Dr. Mondesir for the invitation to join today. Thank you. I'd also just like to acknowledge my appreciation to Mayor Sullivan, Councilor O'Lally. It's great to be able to join you. I also, as I'm acknowledging people, just want to acknowledge that this is actually my second time in Brockton this month. So Brockton has been a very welcoming community for me, and I'm very grateful to be here again today in the good city of Brockton. Brockton Community Health Center had reached out to me some time back as well, Maria here, and the amount of interest and energy that goes into improving the lives of the residents in Brockton is really truly impressive to me, and I'm grateful to be a part of that community. As a commissioner of the Department of Mental Health, and as Bishop pointed out, I've been with the Department of Mental Health for some time. I was appointed commissioner in the height of the pandemic, and like everybody else who was adapting to the pandemic, we all had to figure out how we were going to be able to offer what we need to offer to people, and recognize that particularly under times of stress, that people need their mental health support more than ever. One of my colleagues is also here, Mona, and Mona is responsible. She's the center director in the Brockton Multi-Service Center here in Brockton, so thank you for your service, Mona. One of the things that was a difficult and early decision that we needed to make was, how is the department going to show up during this pandemic? And what I want to let you all know is that we made the decision that the department needed to be open. We were open throughout the pandemic. We remain open today. All of our services were operational. Every one of our programs stayed open 100% of the time during the pandemic. I'm extremely proud of the amount of effort that people put in particularly during these high surge times, when it was very challenging and frightening to figure out, how do we do what we need to do, stay safe, keep the people we're providing service to safe. It was a really big challenge, but at no point was it ever an option for us to close mental health services. We really learned early that we were going to be part of this response regardless, and we're learning now how important it is, even more than ever, to make our services visible, accessible, and present for people. Many of us, myself included, have benefited from mental health services in our lives. I have family members, I've personally benefited, and to be able to join you today and to talk about what we learned during the pandemic and what we need to do going forward as we all recover from this experience. And as Mayor Sullivan pointed out, COVID is still here. And so when I say recover from the experience, I'm talking about recovering from the trauma of going through something that was so uncertain and frightening. We are all going to be managing COVID for a long time. As we learn to manage COVID and recover from this experience, I think it's really important that we never lose sight of the importance of taking stock of where we are with our mental health. We all learned during that pandemic that the uncertainty, the fear, the anxiety, the stress, the depression that many of us experienced became very commonplace. And as it became commonplace, many of us began to talk more openly. as we talked more openly, we realized that we were all experiencing very similar things. And so what was once a very quiet conversation and sometimes a private conversation was beginning to become more open and shared amongst more people. My call to action for all of us here today is to take that to a new level, to make it possible for us all to talk openly about how we're feeling, what help we might need, how we can be helpful to each other. It doesn't take a degree to ask somebody how they're doing and to actively listen to what they're saying. And if we actively listen to what people are saying to us, they will feel supported. And in that moment, we can sometimes find a path into treatment if treatment is needed. And maybe this wasn't the right moment or the right time to start treatment, but if we keep the conversation going, that time may come up. And I want to just say that Brockton just recently opened a brand new inpatient psychiatric facility. That was the other reason I was here. So some of you may know this or you may not, but I just want to let you know that Brockton is now home to a lovely psychiatric facility operated by the Boston Medical Center. And in addition to psychiatric units, they will also be operating recovery units for people with both co-occurring substance use disorders and mental health and primary substance use disorders. So I commend the effort that went into creating this unit here. The hospital will be in operation. I believe they will begin accepting patients as early as October. So I really appreciate all of the effort that the city of Brockton has put in, not just to make sure that people are encouraged to come to events like this and to learn more, but also to the ongoing efforts. There was a coalition that the Brockton Community Health Center led up specifically about how the behavioral health community could join together and to be able to offer the most comprehensive approach to support for the residents here in Brockton. On a final note, I just want to acknowledge that the Baker-Polito administration has made huge investments in behavioral health. And one of those investments is a 24/7 behavioral health helpline that will be starting up in January 2023 that will operate in connection with a statewide network of community behavioral health centers. Through this network and this primary access point, the 24/7 behavioral health helpline, people can call any hour of the day or night and be connected to a live person who will help them determine what the best approach to meeting their needs is, and then navigate with them to get those services and treatment appointments set up. The community behavioral health centers will be able to deploy crisis service if crisis service is needed. Urgent care appointments. This is a new concept here in Massachusetts. Urgent care is something we've become familiar with for our physical health, but this will bring urgent care into the behavioral health space across the Commonwealth. And then ongoing treatment will also be available. So I want to encourage people to keep an eye out for January 2023 when those new resources in the service delivery system will be started up. So I'm very excited to be able to share that good news with you. And then just as a final point, and again back to the call to action, I just want to encourage us all to remember that the kids in our community really did struggle during this time. And for us all to extend a little bit more, remember that they're recovering in a way that those of us as adults probably won't fully appreciate or understand as they reach milestones, developmental milestones that have been impacted because of the requirements. I'm not criticizing the requirement for us all to stay safe, but we all need to be sensitive to the impact that had and to remember to be a little extra kind to the kids amongst us. So thank you again for including me, and I'm happy to stay and answer questions. Thank you.
Let's give Commissioner Dole another hand clap. I heard everything that she said, but what resonated the most to me is being extra kind, especially around what our students are experiencing. So Dr. Dole, that was so important that the community hear that. We appreciate the fact that the Baker Political Administration will be coming out with that helpline. I'm sure there'll be more information that will be available to the residents of the city of Brockton. That is much needed. We're going to just keep going with the speakers giving their presentation. And I want to first say I have a bias because of the work that I've done in education. So when I introduce Dr. Cahill, let me just say this. I can tell you, I'm not going to give away my age, but when I was looking for the school nurse, it was so I can get a letter to go home, Dr. Hill. So and they had these little carts. This is a long time ago, Dr. Hill. They had these little carts. You wait. They would call your mother, and you would come and be picked up after they did a temperature test. So it has been quite a long time, and it is a different kind of field of clinical support for young adults now. At the first instance, nurses are at the forefront of not only concern about physical health, but mental health. So coming into the nurse's office today could be someone that experienced abuse or some sort of other emotional issues. From my background, food insecurity, a young man or a young woman that may not have eaten, nutritional services is needed. So nursing has changed tremendously. But I can tell you what I know from my colleagues at the Brockton High School and across the Brockton district. Dr. Cahill has been an extraordinary leader with respect to the supervisions of the nurses, but also what's important, your own personal commitment. So I wanted to personally salute you for that. Dr. Linda Cahill is the Director of Nurses for the Brockton Public School System, overseeing a staff of 50-plus employees. Linda has been a registered nurse for 38 years, working at hospitals and community settings. Linda received her doctorate of nursing practice from Northeastern University in May of 2018. She was the interim health director for the Brockton Board of Health for 3 months during the pandemic, prior to Dr. Monsieur joining us. The Brockton Public School nurses assisted in contract tracing and various clinics hosted by the Board of Health. That's her bio. At the end of the day, she's at the forefront of supporting our young adults, our elementary students in the Brockton Public Schools. We salute her for that. It is my honor to introduce Dr. Linda Cahill. Dr. Cahill.
So, Eno coined this phrase, and I am very appreciative of our focus should be on unprecedented times during a pandemic and opportunities for growth. So I always look globally, and then I see what's going on in the world, and then I look and see what's going on in the country, and then in our state, and also in our city. So I'm Brockton born and raised. My children went to school in Brockton. My parents still in Brockton. I'm very but vetted in Brockton and will always be. So the World Health Organization declared a pandemic on March 11th, 2020. Schools closed on March 12th, 2020. And we went remote for that remainder of the school year. And it was devastating for our kids and our families. So as you see, the first year of the pandemic, there was not as many students and staff that had COVID, 559, but if you remember back when we first started, COVID affected more elders and more adults than children. And the nursing homes were devastated. It was horrible, as Eno can attest to that. The second year, it was more of, we started with vaccines, and the vaccines were available in December and January of that year to our most vulnerable populations, our elders at first, then people with comorbidities, our first-line workers, and as time went on, more people could get the vaccine. So whenever a vaccine is introduced, there has to be 6 months of good data before you develop vaccines for younger children. So the second year, you see, we had more students get COVID than adults. And now, since July 1st, I'm following the data in our school system as close as I can, we've had 92 students and 25 staff. So it's still around. And we have to remind our staff and our students it's still around, so please protect yourself. So this past week, I thought it was great. The World Health Organization had a presentation on how we can prevent the next, how we can be prepared for the next pandemic. And it was just very timely that I saw this. So it just gave us, this presentation gave us some statistics globally of how the pandemic affected the world. So we had 90% of our health care was disrupted. Economically, we had 16 trillion revenue losses around the world. Education, 1.6 billion students were out of school. And it's estimated by 2030, 135 million people will be pushed into poverty. So it's affecting us still and will continue to affect us. So we went to a hybrid model when we finally started to come back, and I'll explain that a little bit better. The hybrid model the next year was very confusing for families and staff and the students. It was 4 cohorts. You could go to school 2 days a week, and then you'd be homeschooled. You'd have to do work at home the other 3 days, and then it would alternate the next week, and there were 4 cohorts. It was so confusing. And the kids, again, suffered, and the families suffered. So March 16th, we finally got everybody back, and everybody was so relieved that we were coming back in person fully. But when the kids came back, we've discovered all the issues that the children and the families had suffered. So the challenges, you all know we had a lot of challenges, a lot of food insecurity, and my heart breaks. So I know the mayor's office, did some food deliveries like that first year. In the school system, you could pick up meals every day, and then on the weekend they gave you extra if you needed it. And technology, we were really not prepared, not at all. The kids were remote. We had to purchase 25,000 laptops and get them delivered. And we had to learn total new platforms for learning. Quite a struggle. As an adult, it was a huge struggle for me. The kids, they're pretty technologically savvy, but the parents had to teach the kids. And the parents missed work. It was really difficult for families. And we had a new platform such as Microsoft Teams and Schoolology. We all struggled with it. Now I love Microsoft Teams and wouldn't give it up for the world. It's much better than Zoom, so. As you well know, we have a very diverse city. We have, there are numerous languages spoken. I want to say 35 to 50 different dialects. So at the beginning of the pandemic, the mayor was great. He had a language line. We used that. Then the school system has their own language line, which we still use to this day, Lionbridge, and what a godsend that has been as well. And we've also realized that we need to increase our language coaches. So there's language coaches in every school that we're hiring. Huge social, emotional health issues, huge. Many students suffered from anxiety and depression. We had one when we were remote, and it upsets me. We had one suicide at the high school level. They hired more counseling staff to do reach out to families, and additional nursing staff was added to reach out to families. So we realized once we got back in, the kids had a lot of issues settling in, and executive functioning just wasn't there. So we had to have programs to help them relearn how to be back in school, how to follow rules, how to organize yourself. Our poor little ones, the littlest of the littlest, the preschoolers in the kindergarten, they were taught remotely. So when they finally got back in school, they were reading well below grade level, and their math skills weren't there, so we had to implement programs. So this is the second year of our Rising First Graders program, which is, I believe it's done some success, and that was over the summer because the kids that were in kindergarten weren't ready to be in first grade, so they got some extra instruction over the summer on math skills and reading skills. So we realized that the data on MCAS scores, and I'll show you in a subsequent slide, the MCAS scores, how they were affected. Kids weren't reading at grade level, so again, we had to implement programs. So if anybody's interested, I'm all about the data always. You can look on the Massachusetts Department of Elementary and Secondary Education. You can look up the Brockton or any school district you work for, or if you want to just look up data, you can see how schools are doing. So the first page, when you look up your own district, is usually your demographics. So in Brockton, we have a lot of kids that are high needs, like 80% high needs. And we have a lot of kids, 75% that are poverty level. So throw a pandemic on top of being at risk, and it was devastating. So this past year, we have 25 schools. We've shown some improvement. Some schools did better than others. So these are the MCAS scores from the previous years. This past year has not been published yet. I can't speak about that yet because it hasn't been published. But you can see there's negative numbers from 2019 to 2021. They're all negative. So the kids suffered. And that was data from Dr. Ethan Cancel. He's one of our data specialists in the school system. So last year was great. They had 3 focus areas, and I believe this truly helped. Effective instruction, active reading and writing, and focusing on positive relationships. So from what I'm told, the most factor that had the most impact was the reading and writing. Again, I can't talk about data that hasn't been published yet, so just wanted to let you know it's coming. And so planning for future pandemics, we follow disease trends, and Eno will tell you that there are many diseases that we have to keep an eye on throughout the world. You always have to watch that. And so there's many zoological diseases too. Also we have triple E and monkeypox, and we have rabies, and so we look to our boards of health to watch the diseases, the trends. We also look to the Department of Public Health. We also look to the CDC, and we also look to the World Health Organizations. So when disease trends, when it keeps creeping up, then we look to our community partners to do more planning, pandemic planning. And so, as the mayor had stated at the beginning of this, we all got together, police, fire, ambulance, and we have the boards of health, and we had the hospitals, and we had Father Bill's, and we all had meetings on planning. So for future pandemics, we will have to continue to meet if any other diseases pop up. We also want to encourage vaccination. We also want to protect the most vulnerable populations. Our most vulnerable populations are people that are facing poverty, people that are elders, people with comorbidities, people that have multiple diseases, our most youngest, and people that are homeless. So we have to protect our most vulnerable populations always. And I just want to thank the Board of Health and Pinnacle Partners. I was glad to see them here today. They have been great. Department of Public Health is also great in setting up vaccines. We had numerous vaccines at schools. They had vaccines at supermarkets. If you look on the website, they have a vaccine list of who is where. At Westgate Mall, they're doing vaccines. They're doing vaccines at Cape Verdean Association, at various pharmacies as well. And that's it for me.
Dr. Cahill, that was awesome. And it shows you that folks that are committed to this work whether it be in the school department or other aspects of city government, are doing an awesome job. So let's give Dr. Cahill another hand clap, please. I am going to introduce a great man of God with respect to the faith community. And I hope, Reverend Doctor, I don't say your name wrong. If I do, charge it to my heart, not to my mind. Ladies and gentlemen, Reverend Dr. Abraham Waya is the pastor of the Central United Methodist Church on L Street, Mission to the Homeless in Brockton. Dr. Waya is also an award-winning adjunct professor at Boston University, where he also works with the prison education program. Working with the homeless population in the city of Brockton, you are so awesome. Join us in giving your speech. Thank you.
Thank you. Thank you. Is this on?
Yes, it is.
Okay, shake it. I have to be sure that there's a difference between preaching in church and teaching on campus and at a place like this. I want to thank you all for coming. It's a beautiful day outside, and I'm sure that if I had my way, I would be out somewhere else, and same thing for all of you. So thank you for coming. Dr. Montesir, thank you so much for the invitation to be part of this. Listening to everyone who's spoken so far and the policy actions taken to make the world a little better, I am humbled by the nature of the ministries that you all perform. I think often religious people tend to assume that they are the only ones in ministry. Sweeping the street is ministry. Being a commissioner is ministry. Being a servant of the people in any capacity is ministry. Everyone is called to serve in a different way. That's what makes our world a little better. Thank you so much. Mayor, is he still here? Yeah. I want to thank the mayor for the amount of work that has gone into keeping Brockton safe. The week that the state declared that attendance in any group should not be more than 25 persons, I had a funeral. This was announced early in the week, and as we got to that Saturday, a large crowd, packed, just kept coming. We didn't have masks, we didn't have anything, and they're like, well, we'll catch up later. Right? Everybody just kept coming. And it was extremely hard to tell people, this is serious. This is, what do we do when we want to grieve the passing of a loved one, and yet we have to be aware that we don't end up being on that list as well. And so what the church did initially was to just say, well, there's only so much sitting you can sit to each other. And we hadn't quite grasped the concept of social distancing, because we like to hug each other, we cry together. That's what we do in religious communities. But very soon we realized that we needed to do things quite differently. And one of the first things, of course, was to close churches. And that was not a good thing for many. It was the greatest thing for us to do, but there are people who have convinced themselves, and I don't blame them, over the years that God wants us to be in church every Sunday. Therefore, we have to be in church every Sunday. And for me, in order to speak to my congregation, I had to go back and look at the sermons that were preached in 1918 when the Spanish flu came, and they didn't have social media, they didn't have internet, they didn't have Zoom, they didn't have anything, and yet they closed the churches, and I had to go find the sermons from all those preachers. So why did you close the churches? And their answers were very simple. All the sermons were similar. Our love for other people should be greater than our attempt to fulfill a duty. If we love people and we love them so much, then staying away from being together is an act of love. It's not a disobedience to God. It's a way of us showing that we love our neighbors. And I preached that sermon, picked up pieces here and there, and said, that is why we're closing the church, and we are not going to open until this is all over. At that time, I thought, that may be another couple of weeks or so. As I speak to you now, many people in my church haven't come back. I mean, in person. And I applaud them because they are not deceived by this idea that I have to be in church. They are careful about health and well-being, especially those who are living with vulnerable populations. I have people who would tell me, I would love to come to church, but my father is in his 80s and not too well. If I come and I catch something, I will be killing my dad. So I'm sorry, I'm not going to show up. And I appreciate that. Faith communities in Brockton decided, well, what are we supposed to do? How do we team up with each other? And the pastors started having gatherings together, and the mayor's office, Dr. Montesir, actually we started doing this before Montesir became the director of public health, would meet every week to get information as to what's happening in the city and to decide what we need to do in our own congregations. Part of it was definitely closing the doors. The second part was reaching out to people who were in need. I can speak to you on behalf of what we did at Central United Methodist Church. We worked with the the U.S. Department of Agriculture, and they supplied food. We needed to go to Weymouth to pick it, and within that period, we took about 10,000 kilograms of food, right? Let me put it in American language. Let's say 10 tons of food that we distributed. We got there, picked the food, and went from house to house. People who were in need, we got their names, and sometimes I would go myself and a few volunteers will mask up and will try to deliver at their doors just so that there's something. And you can start seeing somebody through the window trying to talk as if they are, it sounded weird. But it was something that many people received with profound gratitude that my church was there for me when I needed it the most. When we met with Dr. Montesir and Dr. Herman and the mayor, we met every week initially, and then we changed it to every other week. We got updates. So not only do clergy share what their own struggles are, how can you help us? We don't have PPE, we don't have masks. Where do we get the resources that we need to do? How can we help the city? And those conversations were very, very helpful. And I'm so glad that the city didn't see the clergy as secondary, but as an integral part of what was needed to make the city a lot safer. And so those meetings were very, very important. And I can tell you how many times I went to the mayor's office to look for masks and cleaning supplies. In fact, the first time I went to the Department of Public Health, they are like, I just came out of Home Depot, they don't have any mask. I went to BJ's, nobody has masks. Do you have any mask? And they didn't. I'm so sorry, we don't have any masks, so you have to wait. Everybody was searching everywhere, but then the mayor's office made it a place where anybody could go any day, any time, and ensure that there were enough masks. And then the vaccination came. And I'm going to say a little bit later about the theology of vaccination, a little bit later. But the vaccination came. I came here and got my vaccination, and Dr. Montesir and I started talking. How can churches help? Because so many people didn't want to come out and they didn't want to stand in line here. And if you remember, the line went all the way out and they were unsure what to do. So we had a discussion where churches could offer their own buildings as vaccination clinics. And we had one at Central where many people who were members of the church were able to come in a safer, smaller space, wide enough for social distancing, but also including people who might otherwise not come out. Many people were scared that because they were not documented, if they came out for vaccination here, this may be a death trap for them. So they didn't want to come out at all. And now they have lost their jobs, they have nothing to do, they are hunkered down at home, mental health is going up, domestic violence is going on. So many things were happening in their homes. This was one exit strategy. It's like, nobody's going to take that, your immigration status, just come and get the vaccination. And he helped make that happen so clearly at the building. And we've been working with homeless people before COVID came, and that was a totally different world. Because our services were in a building, and then COVID came, and we couldn't all stay in the building because they don't care. With all due respect, they are not very high at compliance. When you say, well, you have to wear a mask, like, I will be fine. I live in the woods and I've survived. This is nothing, I will survive it too. Right, so it was hard to convince them. First, you can't come into the building. We moved our services from indoor, outdoor. We'll come in with the clothing for them to pick what they want. Their food, we'll bring it out to the street. But encourage everybody. We had masks at the table. That's what I'm grateful to the mayor's office for, because we had enough masks for everybody to take. And the homeless could grab something and cover themselves, and they would say, I'm going to be fine. I mean, there are worse things on the street. COVID is not my biggest problem. And I understand. But we also know that some of our brothers and friends and sisters out there died because they didn't take this seriously. Speaking about the theology of vaccination, let me say this first. Any illness, we are human. Any illness, whether it's personal or within our families or a pandemic, God is always brought into the picture, even by non-religious people. God is always brought into the picture. And I'm not going to give you a lecture or a sermon on the theology of what happens in this case. Just this one point. Everything that is in this world is in its perfect place. Sometimes when things mix, that's when the problem begins. I cannot assume that the COVID virus was just invented overnight. It might have been out there somewhere in the grand scheme of God's design for this world. It has its own perfect place somewhere. And in the mixture of humans and those things, certain things happen. Have you ever tried, take a glass of milk, squeeze some lemon juice and mix them together? Put lemonade and milk. What does that look like? That's not the best combination, is it? But you enjoy your lemonade, you enjoy your milk, but when you put them together, that's not really the best thing. Nothing is wrong with milk or lemonade. So nothing is wrong essentially in our world except when certain things happen and we're like, oh God, where were you when this happens? I made the world perfect, it's okay. Certain things will happen. It is the nature of things as they are. It isn't the demon or the devil or Satan trying to destroy you. It is the way things are and the way things will always be. We will get sick because we're human, and we will die because we're human. When we invade certain territories, certain things will happen. If you go hunting, an animal can hunt you down too. That's just the way nature is. So I find it hard to try to explain to people where you can't just point a finger at God and say God is responsible for this, because very often it is tied to you did something wrong, you are sinners, this is punishment, as if nature is punishment. So the first thing I would say is when things happen, whether it's in our personal lives or in our communities, we need to understand that this is the nature of things as they are. It is nature being itself. It is not designed to hurt us, it is just what it is. The miracle in that is what God does with the intelligence He's given human beings. So here we are, out of nowhere. This thing starts in China, it spreads around the world, and then doctors who, over the many years, and scientists have been working on this, eventually come up with a vaccination. That is the miracle, is God stretching out to us. And I hear people like, oh no, we don't know anything about this vaccination. It's brand new. They are going to do this to you. It's the end of the world, the New World Order, Antichrist. And I don't know how many I follow these things because that's what I do in life. But I'm like, oh my goodness, what in the world is going on? The scientific mind that worked to make this vaccination possible is a gift from God. That is God's answer to the challenges and the struggles of humanity. That in itself is the miracle. Because if you look back in 1918, when they did not have these vaccinations, it is estimated that up to 100 million people died. And here is the city of 100,000 people, we are looking at 500, like, oh, that's terrible. In those days, 3/4 of certain cities died. And people called, God, where are you? God, where are you? And God this time is saying, here I am in the midst of vaccinations and scientific knowledge. Take it. So I want to encourage us, this is God's gift. To say no to it is to say, God, I refuse what you've given me. I deny what you've done. So encourage our people. And so with that in mind, we had more and more people listening and saying, maybe I'll go take the vaccine. If there's trouble, my pastor will answer to God for it. So many things happen that I cannot really simply thank everyone enough for the jobs that they have done. There are no people here that I can identify in the federal government that I somehow found and reached out to and received 4,800 blankets here in Brockton, which is what we've used to help our homeless population. There's a company that sent us 10,000 pairs of socks, and you can never have too many socks, I can assure you. And all of that is going out, plus the food that we're distributing. So those who are homeless are getting helped, and those who have homes but are dealing with insecurities, food insecurity, rent insecurity, so many other things. And during COVID, many people tried to stay where they were, but afterwards, and the moratorium on evictions ended, many people ended up on the streets because they lost their jobs in the meantime. And the church became the place for them to go. So I think that religion has a role to play at a time of pandemic for this one reason, that we are called to love our neighbors, to share our resources. Not to share the virus, but to share our resources. We are called to love each other. We are called to make the sacrifice, and we are called to listen to God. And when the vaccine is available, we receive it with gratitude. When the rules are set, we receive those with gratitude, and we serve in our communities. Thank you so very much, and I'll be glad to answer any questions.
Stephen Hook has been a significant access to the emergency management, not only as their director, but as someone that is committed to everything that is right about Brockton. Director Hook, thank you for giving us a 1-minute introduction.
Good afternoon. Thank you for joining us. I want to thank Dr. Mondesir and the mayor and everyone that's been involved with today. It's very important that we do this. My name is Steve Hook. I'm the Emergency Management Director for the city. I'm going to give you a little background about myself. I've been in public safety for about 30 years. I've been your Emergency Management Director since 2014. So I had a whole presentation put together, but we'll keep it brief. So just some of the things that I've done as Emergency Management Director since 2014. We've had some emergencies in the city, and right in 2014, we were thrown right into it. I went from the frying pan to the fire, so to speak, for emergencies in the city. So you remember, if you're born and raised Brockton like myself, you will remember in 2014 we had a situation where we had no water. Then we went into blizzards, and we had to call in the National Guard, and the list goes on and on. So we have some experience in dealing with some of this, and we have practiced pandemics. Never thought we would have to do it, but here we are. I just want to be brief. I just want to tell you a little bit about the Emergency Management Agency, because a lot of people don't know what we do or what we're all about. So the Emergency Management Agency is a part-time department of the city. We have 3 part-time employees, including myself, and we're responsible for preparedness, response, mitigation, and recovery. The Emergency Management Circle. So preparedness, and we'll keep this on focused on COVID-19. So some of the stuff, we're responsible. The Emergency Management Agency is responsible for developing plans to respond to, mitigate, and recover from disasters, man-made disasters, natural disasters. We have a great fire department. We have a great police department. We have a great school department. We have great departments in the city that handle the day-to-day stuff. Emergency management doesn't need to get involved in that. We get involved in the bigger incidents, bigger disasters, where we need, it goes beyond our local jurisdiction. We need to bring in state and federal resources. So, we have a comprehensive emergency management plan where, unfortunately, I have to think of every bad thing that could happen. And we put it in writing, we plan for it. And pandemics was one of those things that we certainly planned for. There's a lady named Jeannie Benacaza, who is now the Undersecretary of Homeland Security. And at the time, a few years ago, she was a consultant for the city. And she came in, probably around 2014, she came in, she said, I need the city of Brockton to plan for pandemics. And I'm going to be honest with you guys, because I'm pretty black and white when it comes to things. I said to myself, we're never going to have to deal with this. So, this is a 100-year thing. I'm certainly not going to have to deal with it. So I got to give Jeannie credit, because she pounded into our heads that we had to do this plan, we had to do this plan. And I have the plan here. It's about 100 pages, okay? And we completed the plan in about 2 years. We met with all the departments and agencies involved and put it on a shelf. 2 years later, she calls me up and says, what have you done with the plan? And I said, well, it's on the shelf. When we need it, we'll pull it out. She goes, I want you to practice the plan. So we got together. We have a 110-member CERT team, community emergency response team in the city, that we rely on volunteers. There's only 3 of us, right? We're a part-time agency. When something bad happens in the city, we rely on volunteers, and we train them to a certain level to respond and assist in disasters. So they were an important part to this emergency dispensing site plan. So we got together, we practiced the plan, and we practiced the plan, and we practiced the plan, and we practiced the plan over and over and over again, and we did this every 2 years. Every time I put it on the shelf and said, we're never going to have to do this. We're never going to have to do this. But boy, was I wrong. But I'm glad we practiced the plan, okay? And we used the exact plan, that emergency dispensing site plan. It's called the EDS plan. We used that, and it was probably one of the proudest days of my life when we were able to use that plan to vaccinate our first responders, our police and firefighters. And then we did it to vaccinate the seniors and the vulnerable population. So that was a very good day for all of us. So early on, Mayor was sworn in as mayor. About a month later, I met with him and I said, Mayor, we got to talk about this COVID-19, or it was coronavirus back then. And I said, we have a plan, this is the plan, we have a plan to respond to pandemics, we have a plan to respond for emergency dispensing site. So we met, the mayor he was on the job for a month, and here we are talking about pandemics. And I want to take you back to that time, because if you remember back then, nobody knew anything about this coronavirus, and we were all nervous, right? People didn't come out of their houses at one point. People stayed home. People didn't know what to expect. We were all nervous. But the mayor really took the bull by the horn, and he got the key players together. And I remember very early on, probably before coronavirus was even in the United States, we were meeting about it with key stakeholders. So mitigation, now we have coronavirus, we have COVID-19, what are we going to do about it? So we were very fortunate. We worked with the state, we worked with MEMA, we worked with DPH, worked with the governor's office to get PPE. And we have a lot of it. We still to this day have a lot of it. Like I told you earlier, I plan for everything, right? It's my job to think of the worst thing that could happen and plan for it and be ready for it. So early on, I went out and I bought masks, those blue face masks. And I had 19,000 masks in our storage room in the city someplace. And once in a while I go down to the storage room and I say, what do we need these masks for? They're taking up space. But I'm going to tell you, boy, was I glad we had those masks when this thing hit, because those masks went to the first responders, they went to boards of health, they went to the hospitals. We had that initial supply of stuff. And then we had a lot where we couldn't get stuff. We couldn't get PPE, but we were able to open up those chains, those distribution chains, and we got a lot of PPE. We got tractor-trailer trucks loads of stuff. We were bursting at the seams at one point. So the other thing we did early on was, in the very beginning of this, the issue that we had was the homeless population, right? They were getting COVID, and the reason they were getting COVID is because they couldn't socially distance. So we set up tents in Perkins Park. Some of you guys may remember that. And we have some pictures of that coming up, but we set those up very early on, so the homeless population could socially distance. And this was really before the state was even, we were doing stuff in the city of Brockton, and I have to credit the mayor, because we were doing stuff before the state was even doing stuff. And I think the state kind of looked at what we were doing and implemented some of that stuff along the way, honestly. So some of the other things, we ultimately we set this facility up to be a testing site and then a vaccination site. Like the pastor said, we had meetings every single day. I met with the mayor. I met with the Board of Health Director. In the very beginning, we had an interim Board of Health Director. There was no Dr. Herman, so it was really the mayor and I, and the interim Board of Health Director. So as time went on, things changed a little bit, but we met every single day, sometimes 3 times a day. And of course, at the we established partnerships with, I'll tell you, Maria's over there, Neighborhood Health, unbelievable partner in this whole thing. And it came months later, but she came to us and we went to her, and the Signature Health came to us, and Good Samaritan, and said, we need to set up testing sites, right? And we said, okay, let's set up testing sites. Where can we do it? Let's get some tents and we'll do it in the parking lot of the Brockton High. And collectively, we ran them. So we assisted them, they assisted us. It was a good thing. The bad thing about the tents is they kept blowing down, and we had to replace them every so often, but we got the job done. In recovery, we're still in the middle of recovery, right? We're still in the middle of mitigation, really. So recovery, basically, and this is something that the mayor's office, I have to give them credit for. They're informing and assisting residents of, programs, state and federal programs for financial assistance, mental health assistance. So these are just some photos. The last 2.5 years have been the most challenging in my life, okay? I've been to tornadoes and hurricanes and all types of task forces in other parts of the country, but this right here in my own city was the most challenging in the last 2.5 years. But I'm happy that I was able to do it, and we learned a lot. It brought a lot of the city departments together. We practiced the plan. One thing, early on, I wanted to mention, when the pandemic first started, I said we got to have an emergency department head meeting. We got to talk to the department heads about this pandemic that's coming. And it wasn't here, and people thought I was crazy. But when we got into the room, I said, listen, department heads, you guys need to think about your continuity of operation plan, or what we call a COOP plan, right, emergency management. And I know who my number 2 is and who my number 3 is. The fire department, the police department, they know who their number 2 and number 3s are. But does the auditing department know that? The people who process the payroll, does the treasurer's office know that? Does the Board of Health know that? So I encourage them to develop a continuity of operations plan, just in case the number 1 person, number 2 person, number 3 person got COVID and that department couldn't run. And let me tell you, that is exactly what happened. We had city departments that were wiped out due to COVID, and luckily they had thought about this continuity operations plan. So thank you very much. I'll be happy to answer any questions at the end.
Hi, everyone. I'll try to keep it brief. I know we're pressed for time. I'll give you the Reader's Digest version as best I can. My name is Will Schliemann. I'm a lieutenant with the Brockton Police. I'm currently assigned to the Community Education Unit. When COVID hit, well, let me back up. A little bit about me and my personal life. My wife is an ICU nurse in a Boston hospital. So I had a great window into the effects of COVID and the real world ramifications and folks passing away. She would come home at the time our children were younger. They were 7 and 12, and we had to tell them, you can't hug mommy until she comes in, shreds the scrubs, and gets into the shower. So she would leave her shoes at the back door, jump in the shower, then the kids could say hi. And as Dr. Cahill remarked about the online learning, that was real for us. You bring me back, trip down memory lane, leaving a 7 and a 12-year-old home alone, because both mommy and daddy were frontline workers, had to go to work. and expect that they could get through the school day. That was very difficult, especially when I realized my 7-year-old was getting tardy. When she got her first report card, she's tardy for school. I said, how are you tardy for school? You just go downstairs and you log in. Well, she wasn't doing it in a timely manner. So, back to me professionally. I work in the community education unit. I'm also responsible for the police department's first responder CPR instruction, keeping everybody up to date with that. I'm also a licensed EMT, so when we started getting sick calls and planning for COVID, I became the department's point person. I triaged everybody that called in sick, checked in with them, so my phone rang day and night. It kept me busy. We had to come up with our contingency plans if we lost a lot of personnel. And just real quickly, we separated our cruiser teams. So folks that were partners, police officers that were partners that always rode together, we had to separate them and put them in separate cars just to try to protect the workforce. Now, this is a workforce that's used to running into danger and the unknown. They wanted to be together, so that was hard for a lot of folks to be separated. And what we also struggled with, as you imagine this is a struggle, officers canceled their vacation plans. They came to work. Sense of duty, a little bit, and I think you couldn't travel. So they canceled the vacation, so we had a lot of officers showing up to work. Trainings were canceled. Those officers that were supposed to be out at their annual training were coming to work. Now all of a sudden we had more officers than we had cars. What do you do? So eventually folks got back together, they rode together. It's just a unique situation where we travel through a lot of different people's houses on a daily basis on calls for service. We might be on a medical call giving CPR. We might be trying to arrest someone and wrestling on the floor. We take these folks, we put them in our police cars, we sit with them a foot away from us, we drive them back to the police station. We bring them into a police station, we book them, we spend a long time with them. They go into a cell, they come back into our house. So it was difficult to deal with and manage, but we absolutely got through it. I couldn't be more proud of the men and women I work with. They did an amazing job, and again, they went right into danger and the unknown, head up, and sprinted in. That's all I have. That's my best Reader's Digest version.
The next person up for a introduction will be, looks like Gregory Davis, Regional Operations Manager for Brewster Ambulance. Welcome.
Good afternoon. My name is Greg Davis. I'm the Regional Manager for Brewster Ambulance Service. A lot of people hear private ambulance service and expect we're taking people back and forth between hospitals, nursing homes, hospital to hospital, community hospital to city hospitals. We also do the 911 service for a lot of cities, one of which is Brockton, Taunton, Plymouth, Framingham, a lot of big cities that we provide 911 services to. It was February-ish, actually January of 2020, when private ambulance service was called to transport a international student from one of the colleges in Boston who came back from China, who had symptoms. And we dubbed that our first patient. Come to find out it was the first patient in Massachusetts with COVID. And then that rolled into some other things from there. I think people may have remembered the Biogen conference, which was occurring up in Boston. This was the super spreader event that brought COVID to Massachusetts. While that was happening, we were getting calls in the private ambulance service to go out and pick up Biogen employees at their homes, transport them to Brigham and Women's Hospital to be tested, and then take them home. And that's how testing started in Massachusetts. Some of us paramedics, EMTs, were sitting in a room, this is crazy. We shouldn't be doing this. We shouldn't be transporting people to be tested. Let's test them at their homes. So we started working quickly with the Department of Public Health, with the Office of Emergency Medical Services to see how we could do testing differently in the state of Massachusetts while a pandemic was erupting. And this led to a lot of things. We remember hearing about the soldiers' homes in Chelsea, out in Springfield. We remember hearing about the skilled nursing facilities or nursing homes, congregated living, the apartment buildings, whether it be here in Brockton, Chelsea, lots of people living in one area, the homeless population. Then we started thinking also prisons. What are we going to do with all these people that are inside and stuck together? So we had to break out into testing, and that's what we did in EMS. So private EMS hopped on very quickly, as many others did, to help out with testing. That happened here in the city. Over at Massasoit, we were pumping through about 1,200 tests a day, right in one parking lot. Then it was happening here, it was happening at the high school, it was happening all over the place. What we had to do was change our staffing, take EMTs, paramedics. We had to hire nurses, LPNs, and just to let you know, EMTs and paramedics do not like nurses. Nurses do not like EMTs and paramedics. There's 3 or 4 of them back right there right now for me who actually all get along now. So it's amazing. It's amazing what happened. The other thing was the original testing, if you had one, was very deep. It went posterior, it went way down the back of your throat. That's how we test for the flu. So this is a flu. That's how we're going to test. Everybody was so happy when we just had to do the outer side and the anterior one. So as that changed, we had large-scale rapid testing. Remember when rapid testing first hit the streets? Everybody was so happy. It all went out of stock. Where are you going to get this? Where's it going to come from? At the time, things were just slowly opening up. The schools were just slowly coming back together. We were starting to have more and more people in the skilled nursing facilities and the prisons, and we were asked to mobilize for that. One of the things we did here in the city of Brockton, working with Linda, was to test teachers, offer rapid testing for the teachers. PCR tests were still taking 3 days, 4, 5 days for results. We could get it in 15 minutes if you could get your hand on a test. Same thing at some of the larger colleges. They wanted to get students back in, so they wanted us to do rapid testing there. So we went all over the place. We went from Springfield down to Provincetown, all the way up to the North Shore where we started doing testing. It was great. It was a new place for opportunities for staffing, but it also allowed people to get tested, make sure they were fine before they were going home. And then came the good old vaccinations. And we all remember the phases, okay? Healthcare workers first, then the elderly next, and it went down the line. People with certain medical conditions. The big thing for our people, which I said I have 4 people sitting out back right now still doing vaccines, was don't waste a dose. We had lists of names, who to call if we have an extra dose. What happens if we were able to draw an extra dose? A lot of people here in the audience remember this. It was crazy. It was like, did you get a shot? Yeah, I already got one. Stop asking me. So we could get shots to everyone, but we couldn't waste a dose. But we were able to get that done. And it was working with everyone that we learned that we could get this done, whether it was helping out here at the Shaw Center, whether we were going into homeless encampments, but we also took people and we took them off to their homebound people. So we had patients that were stuck at home, and we'd go in and just do a single dose in one home and then move on to the next person. But we had to make sure we got 10 people that day so we didn't waste a dose. The vaccines went everywhere. It was a proud day when we had that huge empty container of 200 vaccines were given in a day. Our highest number was 1,200 out of this facility here. I mean, those were just huge numbers to get through. So as you can see, the number is well over 15 million here in the state. Many people in this room had something to do with that, whether they were encouraging people, whether they were giving the shots, whether they were setting up clinics. A lot of people had a lot to do with that. What we learned, though, is that you had to pay attention to everything. Things went out of stock quickly, whether it be testing supplies, whether it was PPE. We had to really watch our PPE in the beginning, or when it came down to vaccine. We scheduled vaccine clinics 3 to 4 weeks for your second dose. I remember sitting with many mayors of many cities, many selectmen, and telling them, we're not going to be there. But you have to, it's the second dose. We don't have it. Moderna wasn't able to produce it. Pfizer couldn't get it to us. There was a CDC supply chain, and we had to postpone people. There was a lot of communication that had to be done, and that was very time-consuming, and it threw a lot of people off because we already had dates set up. It's kind of like a snow day for a wedding, right? You have to push it off and push it off. But we worked together, and we were able to do it. Some people mentioned this earlier. We had a lot of burnout. Steve mentioned it, going to tornadoes, hurricanes. When you go to a storm, the storm's over in a couple days. A couple days later, people are getting their power back. A couple days later, they get their water, da-da-da-da-da. This was happening daily for us. Our staff were coming to work, prepared to take care of somebody, and then their whole ride home, they had to hear the death tolls on the radio. Then they had to deal with their family. As the officer was saying, he had to go home and wait for his wife to get cleaned up before she could come in and say hi. things like that. So that was burning out our staff. We didn't have the ability to get together with our friends, our peers, our families after work just to decompress. And then, hey, I need you back tomorrow for a 13-hour shift. I need you back for 16 hours because I need you to travel all the way to Springfield and then come back. So our staff felt that. So we had to really keep an eye on our staff, reach out to them, listen to them, but also help them out. Hey, I can't work this shift. Take it off. We'll figure it out. And a lot of our staff stood up and said, I'll take it. I'll help out. I'll become a team lead. Today we're going to run 5 clinics instead of 4 because I'm going to be a team lead. So they really helped out a lot. Social media is faster than all of us. The CDC would make an announcement. We had pediatric doses. The governor, God love him, would say we're going to start pediatric clinics on Friday. It never shipped to us on Friday. So the press is standing outside saying, where's this? What did you do wrong? We didn't do anything. Pfizer hasn't shipped it yet. So we're standing there waiting for these things to happen. So we learned a lot from social media. We need to change processes and roles quickly. Much of our team, like I said, one day they're coming in as an employee, the next day they're a team leader, the next day they're helping order things from DPH. We also found just-in-time training, teaching people how to do a swab in someone's nose quickly so that we can teach them and get them out in the field so that we can get people testing teachers, testing prisoners, testing inmates, getting people tested quickly. All ideas need to be heard. I forgot who mentioned that earlier, but that's absolutely true. There's a lot of different ideas, and sometimes they stick, sometimes they don't, but it all helped us. But the big thing I have up there is Burger King, have it your way. We had a lot of people coming in that were very, very upset that their appointment time was pushed back an hour. They were very much upset that, what do you mean you ran out of tests? In the end, I kept telling people, this is a pandemic, it's not Burger King, I'm sorry. But we had to work through that. And that put a lot of stress on a lot of workers, as well as a lot of people that expected. I just drove 10 minutes to sit in line for 4 hours in a parking lot to get tested, and you're out of tests. We have to set our expectations a little bit, and I think that came back to the social media part. Thank you very much for having me. Thank you all for being here today. You guys all have a great day.
At this time, respectfully, fairly quickly, Dr. Maria Selly of the Brockton Neighborhood Health Center.
Well, Dr. Mondesir, I want to say thank you to you for so many things, but certainly for the partnership that we've had during this unprecedented many months, but also for putting this together, which I realize at this time has a small group of people here, but it doesn't surprise me that somebody as sensitive as yourself would understand the importance of having to process what we've been through collectively as a city, through really a chronological view from multiple perspectives. I mean, here we have from a state perspective as the commissioner. Thank you for being here, Commissioner Doyle. From a faith-based perspective, from the educational perspective, emergency management, first responders, healthcare. So I probably should have started by saying, my name is Maria Celli. Hello, everybody. Let me always start from the beginning. I am currently the Deputy CEO at Brockton Neighborhood Health Center, and I'm a psychologist by training. Was the Director of Social Services when COVID hit in March of 2020, hit us anyways in March, in a very personal way in March of 2020, but had just been appointed to become the Chief Operating Officer, which was scheduled to occur in September of 2020. And the then Chief Operating Officer, Linda Gabrick, who's fantastic, works at Bridgewater State University now. But she said, Maria, what do you feel inspired to do? And I said, well, I mean, obviously I'm still Director of Social Services, but as a developing COO and seeing what's happening, I don't know anything. So she said, well, pick something. And I said, okay, we need to stand up testing as soon as possible here at the health center. And we did. We had our first tent outside of Brockton Neighborhood Health Center's Main Street location. Our staff developed our first plan for this testing site, and we launched it in, I believe it was April 1st or April 4th. And then I started to get a feeling for that. You know, how do you stand up a testing tent? Where are we going to get our test kits? You know, where are we going to get our specimen collection kits from? How are we going to all the operations and logistics associated with that. Then we had the good fortune of, our CEO had been meeting already with the mayor since, before COVID had really become exacerbated in the city. I was privileged enough to start to join those meetings with Dr. Herman, Steve Hook, and those partnerships really started to congeal for me. And we were able to stand up so many of the miraculous gifts, honestly, that we were privileged to be a part of, with the strength and leadership of the city in any way that Brockton Neighborhood Health Center could support it. So I think, it'll take us a very long time to understand how this experience has impacted all of us. I think we'll be reading about it decades from now, from a psychological perspective, from a sociological perspective, anthropological perspective, locally, statewide, nationwide, globally. But for me, it feels like a gift, a privilege, an honor, and I'm humbled to have been in this historic moment with the city, with the help of the state, with the faith-based leaders of the city, with our friends in the education department, working elbow to elbow with law enforcement, with the daily support of the Brockton Emergency Management Agency. And I say to my kids, I have 3 young kids who also had to wait to hug me every day that I came into work. I'd get home, do the whole, the dog. I could see the dog before I found out pets could also get COVID. But the dog would always come out and I'd say, hi, Moose, and then I'd change and hug my kids. But I said to my kids all the time, I know this is really hard for all of us, but I want you to understand that we are a part of history. So if I'm coming in very early to the vaccine clinics with the National Guard and with the city, testing, I would show them the videos. I'd say, look at the new testing site we just set up. Look at this new partnership we just started. This is a part of history. We are a part of history. We want to remember that we were on the right side of history. Make the tough decisions to save our collective wellness. Your mom, I'd say to them, your mom, and by extension you, are a part of something that's bigger than any one of us. It's bigger than me. It's all of us. So I want to say that's been a privilege.
Thank you. At this time is Director Mona McKinnon.
Good afternoon, everybody. My name is Mona McKinnon. I work for the Department of Mental Health. I am the Brockton Multi-Service Center Director. We're a public service agency. We are proud to be part of the community. We like to work in collaborations with all the other agencies. I was very glad to form a relationship with Dr. Montessor several months ago. We've already collaborated a number of times. We have existing relationships with Maria, the police department, and look forward to working with everybody continuously, whether it's COVID or whatever issue arises. I'm happy to answer any questions. Of course, I have DMH applications. If anybody wants a DMH application or has any questions about services that we might offer, and I look forward to working with you all. Thank you so much.
This is a dashboard that we do. We used to have that daily, but DPH has gone back to once a week where they give the dashboard. But on a daily basis, we have the update active or positive cases. So for instance, if you look at on the left-hand corner where it says 87, no cases this week. So basically, we update this within the CD dashboard daily because we have that number from our nurses. Pick that number from MAVEN. MAVEN stands for Massachusetts Virtual Epidemiological Network. So this is a system a surveillance system where each Department of Health, boards of health, picked up the infectious disease cases. And for this matter, we picked up COVID cases the last 24 hours or so. But the reality is this is not the real issue, the real number, because this reflects only people who have tested on official sites or PCR, polymerase chain reaction, which is an official test. And so what we do, along with this, we also have access to sewage or wastewater sewer. For instance, this week, the BioBat, the institution or the lab that produces the numbers for Brockton, they're out on a retreat, and so we don't have the number. But if you look at the dark number here, it says 2,790,187. What that means is the concentration of COVID viruses in 1 liter of sewer. This is a little bit more telling than the number that we showed you earlier. The only thing it cannot tell us is exactly or specifically how many cases of COVID are there in the sewer, because there is, we try to establish some correlation. In other words, with this, can we really tell? No, we cannot tell exact number, but it tells us that the numbers are increasing. Also, it's compared on the here, you probably can't see it, but there is like a very pale green number. That green number is a comparison with us. This is the red line here. This is where we are, and then the rest of many of the other sites, they have the green line, which means that we're over 2 million copies of the virus per 1 liter, whereas most other sites outside the municipality or in other states, they're about 800,000 copies per liter. So which means that we are a lot higher in the city. Also, because we don't have the results of the home test kits, no one knows really how high COVID is in, I can say for Brockton because I'm speaking for Brockton, but that is the same across the state or across the country. So it's not over, and that is why you see outside we are still offering testing, and then we are still vaccinating. Thank you, everyone. It's been a day. It took a lot of preparation, but we come to the end of it. If you can, I don't know what time you arrived, but you noticed that you were receiving stickers because there are questions that we wanted to capture during this event, during this symposium today. So that was the whole reason behind the stickers that you were handed this morning when you walked in. So first of all, I want to say thank you to our great speakers and panelists. Thank you so much. We already went over by a few minutes, forgive us, but this is our first ever public event, first symposium with the Board of Health of Brockton. So we hope that this is not the first one. I mean, this is not the last one, sorry. It is the first, but we hope it is not the last because we have a lot to learn from each other. So we have a little token, which is a souvenir, perhaps not for your presentation, but for attending the symposium. You could not be paid for your being here on a weekend. I know the sacrifice, but want to say thank you. So we have some of our staff here. We have 3 nurses. This is Len Demosthenes. And the youngest person that spoke, that's her daughter, and I'm going to, and we have Jessica Cabiles, and Mom talked a little earlier, and we have Gachina Aliot also, and we have Eunice Barbosa Billy, who is contact tracer case investigator, and we have someone who is a physician back home in Haiti, but she is trying to get her board here. But for the time being, she works as a contact tracer case investigator. Dr. Marie Toussaint. We're going to ask him to take a mug that we have, and they can pass one to each of our panelists and speakers, just to say, please, this is just a token as a souvenir.